Now today's topic of discussion is algorithm for the management of shoulder dystocia, which is there in the appendix 2 of the RCOG Green Top Guideline 42. Now this algorithm is very, very important, and the sequence in which things are to be done is also equally important. So today's discussion is the mnemonic for remembering this algorithm. Now, shoulder dystocia, as we all know, is an emergency, and this beautiful sister is always there on an emergency duty. So this time she's managing a shoulder dystocia. Last time she was managing a hemorrhage. This time she's managing a shoulder dystocia. So the first thing she does when she's stuck in an emergency is she calls for help, and so she's called for help. So we are very familiar with these three people, that is the obstetrician on duty, the anesthetist, and the senior midwife. We know them from our previous videos. And this time she is also called for the neonatologist, because it is said that the baby will start to get compromised if the delivery doesn't happen in 5 minutes. So the neonatologist has to also be called for. So the sister is, and apart from them, she is very, very busy, and side by side she is also telling the mother, don't push, because if you push, the baby will get all the more stuck. So she's called for help, and she's telling the mom, she's handling everything together. She's calling and she's also handling of course it's a delivery going on, so she has to attend to the pregnant lady also. So she's telling her not to push, and she's calling for help. Now when she was calling for help, suddenly Robert Brownie Jr., he heard that somebody is calling for help, and he's always the hero, so he comes. So Mac Roberts maneuver is what I'm trying to remember with Robert Brownie Jr. So he's the Robert. So Mac Robert maneuver is what we have to do next. Now Robert Brownie Jr. is there. There is too much pressure. See, the labor room has become a pressure cooker. We all know when there's somebody very eminent around us, we have to be working very, very hard. So the efficiency goes high, and also goes the pressure. What is this pressure that I'm talking about in the presence of Robert Brownie Jr.? This is suprapubic pressure, because we all know fundal pressure is not indicated, or it is actually contraindicated in shoulder dystocia. So the pressure that we're talking about after seeing Robert Brownie Jr. is suprapubic pressure. Now with so much of calling, and the hero has come, we have this doggy. Now he is a hi-fi doggy. He's very fond of watching Robert Brownie's movies. So he follows. The moment the pressure is high, suddenly they also see this dog is coming, and this dog's name is Tommy. So that is episiotomy. Now Tommy will come, not always. If needed, Tommy comes. So episiotomy, if needed, Tommy will come. If there is a possibility that he can come, he will always not be allowed in the labor room. Of course, he is a dog, so he'll be called if needed. Now, after Tommy comes or doesn't come, if the baby doesn't deliver, now we have to ask for help from more and more people. So we can ask the postman also to come and help. Now, postman. By post, I mean deliver the posterior arm, and by man, I mean internal rotational maneuver, or the Woods maneuver, where we try to rotate the posterior shoulder in such a way that the impaction of the anterior shoulder doesn't happen. The distance between the two shoulder, it becomes in the oblique diameter. So pushing the posterior shoulder to release the impaction. That is the internal rotation maneuver. Now, depending on the clinical practice of the attending obstetrician, we have to decide which maneuver is to be done. Is it the posterior arm maneuver or the internal rotation maneuver? Or at times, if the patient is in a community setting, if not everything is possible, then in those cases, the all four maneuver can also be done first. So these three, actually, there is no rule which is to be done first, but yes, whichever position we think is appropriate in that setting, we will do that maneuver, either the posterior, the postman, or the all four. Now, once the postman has come, after the postman, there is nobody left to help. So you have to call the consultants. So this is the consultant obstetrician and of course the anesthetist. See, they're old people, so they cannot be the duty doctors. They are so the information is sent to the consultant obstetrician and anesthetist. Now the patient understands that nobody is going to help me, I have to help myself. So because nothing is getting done, so she starts to take things in her own hands and she comes into all four positions. So the chart says all four here, but if we read the text of the guideline, it revolves like these three can be done, whichever is more appropriate. And if things don't work out, we can again start from Mr. Robert Brownie, that is Mac Roberts maneuver. So we can again come back and start on from here. Now suppose everything fails. So the last resort is the very poor resort for delivery, because by this time, almost in most of the cases, 5 minutes have passed. So the baby starts to get compromised. So either we do a clidotomy, that is we cut the clavicle of the baby, or we do symphysiotomy, we cut the symphysis pubis in a way that we can separate the two bones and increase the space in the pelvic outlet to release the impacted shoulder, or we can do the Zavanelli maneuver, that is pushing the head into the vagina back and trying to deliver the baby by C-section. But as I said, as we all have known that by this time the baby is very likely to be compromised, so none of these maneuvers, procedures will be of much help. So this is the third line. After the first and second lines have failed, the third line is this, and this is the way we deliver a baby with shoulder dystocia. Now once if you're lucky and the babies come out alive, and whatever, the baby is out alive, or in whichever condition the baby is delivered, it is very, very important that the baby is being attended to by a neonatologist. And if the need be so, then the consultant neonatologist might also be called for. So this is in a nutshell the algorithm for shoulder dystocia. Our emergency sister is bang on there, and she is guiding the patient and also calling for the doctors. Here we also have the neonatologist in the team who's been called for. And since people are asking for help, the hero comes. Robert Brownie Jr. comes for help. The moment he is there, there's a lot of pressure in the labor room to see him. Tommy is also wanting to come, so episiotomy, if needed, the dog will be allowed inside. Now after so many people have come, we have a postman who was going outside the labor room. We will call the postman for help, and if nothing works, then definitely we will inform the obstetrician and anesthetist, consultant, and lastly the lady understands that she has to take things in her hand, so she goes all for. If all of this fails, then the third line is glidotomy, Zavanelli, or symphysiotomy. And remember, once the baby is born, the baby needs to be attended to by a neonatologist. So, this is in a nutshell the sequence of events that need to be followed while managing social shoulder dystocia. I hope this makes it easy and clear, and hope this is easy to remember as compared to the main chart. So thank you. And yes, one more thing which I wanted to add on to this is there is a beautiful, and last but not the least, let's not forget our friend who does all the recording in all the emergency patients. And the recording in this patient is very, very intricate. This is the documentation for shoulder dystocia. It's a complete form that is to be filled in. So it is very important to remember that documentation of shoulder dystocia, like any other emergency patient, is equally important. So, except for the special steps for social shoulder dystocia, a lot of things match with emergency obstetric patient, like antepartum, postpartum hemorrhage, where documentation, calling for help is an intricate part of emergency management. Hope it helps. Thank you.